This is Aging by the Bay, here to provide families in the San Francisco Bay Area pertinent information about healthy aging practices and services. Your host is Ajay Sani of Comfort Care Home Care.
Good morning and welcome everyone to Aging by the Bay, where we provide families in the San Francisco Bay Area relevant information about healthy aging practices and services. I'm your host, Ajay Sani from Comfort Care Home Care. With Comfort Care, you can give your loved ones the best life possible, thanks to complete in-home care for every stage of life. Find out more at comfortcare.com or call us at 1-800-886-4044. At Aging by the Bay, we talk about joys and some of the challenges of growing older in the Bay Area. We talk to experts about what they see happening as people age, as well as the services that are available that you or your loved ones may not be aware of. Today, I would like to welcome Dr. Michael Abdel-Malek, who is a board-certified in internal medicine and medical director of CareOne Home Health in Bay Area. He has experience in hospice, palliative, and geriatric care for about 20 years. Good morning and welcome to the show, Dr. Malek.
Good morning, AJ. Thanks for having me.
So let's start. My first question is I'm just wondering, health is wealth, right? And in order to protect the most precious wealth, which is our body, we rely on the complete healthcare system. During this COVID-19 climate, we are encouraged to shelter in place and stay inside our homes and maintain social distancing when we go out. So let's start today with what kind of support system is available to face the challenge that we are dealing with today.
Yeah, it's an unfortunate, challenging environment that we're faced with. As human beings, we're all social to one degree or another. And being sheltered in place, being confined, is very challenging for on many different fronts and aspects. And obviously, this level of challenge is different for different age groups. In particular, for our more elderly population. There is already, in many circumstances, some lack of socialization, whether it be because of loved ones who have passed away, whether it be because of the living arrangements that population has, whether it is a level of dependency and loss of independence, still living at home, or in a home environment versus an assisted living facility, a board and care home, skilled nursing facility. Each one of these living arrangements carries its own challenges on a day-in, day-out basis prior to this change in socialization that we have been confronted with in this new COVID environment. So within the healthcare industry and field, there are several different ways of receiving help and guidance for socialization. One of those arenas is, if deemed appropriate by a person's healthcare provider, home health can provide some form of socialization while helping, more importantly, with your overall health care and well-being. Where you have nursing staff, where you have home health aid, where you have physical therapists and occupational therapists, not only to socialize with you during their visits, but also with the medical background and training to be able to monitor your health care and be a direct communication and line to your treatment team,
right?
Your different physicians, your primary care doctor, if you have subspecialists that are involved in your care as well. There are also other ways that your primary care physician or healthcare providers can help with helping you to address that social need, whether it be through a senior community services, social workers that can help as well.
Excellent. Yeah, home health services are a great help during the recovery phase as the patient get access to nurses and social workers and therapists, all these things you just mentioned. Yeah. So what are the key points we need to consider when we are picking a home health company? And first of all, can we pick one? And what options generally patients and families have? So maybe you can provide us a quick overview how the whole home health services thing works.
Yeah, more than happy to. There are a lot of confusing aspects of different types of home health care that can be provided.
Okay.
So within medical home health, this is a benefit through health insurance, for example, and largely the one that's used the most is Medicare due to the age of the population that really benefits most from home health. And so it's a Medicare benefit, and like most aspects of Medicare provided health services, it's the onus of the home health agency to be able to show that they're benefiting the client and show that there is progress or improvement that is being had so that that benefit can be continued for a window of time. Once a person plateaus or has gained all the benefits that the home health agency was charged for through the referral by the treating provider, then that service is stopped through Medicare. So it's akin to if a person unfortunately is hospitalized and during a hospitalization they become overly weak and require going to a rehab facility. Once they're in a skilled nursing facility, Medicare is checking their charts on a routine basis to show that they're benefiting from that service. So Medicare continues to pay for that service. Once there is a plateau or a person, for example, if it's weakness, physical weakness has improved to the point where they can return home, then Medicare will let the facility know, okay, we're going to stop paying for the services you're providing by X a date, which is a target date for that person to then graduate to returning home. Same thing with home health. Once a person is at home, their referring provider, a physician, has deemed that they would benefit from the services of the home health agency through nursing and, as we mentioned before, physical occupational therapy as examples. Once that person has improved to the point where they no longer are in need of those services coming to the home, then Medicare will say, okay, those services will no longer be paid for and the service needs to end.
Got it. So in that sense, there can be two scenarios, at least. One, a person is in hospital or a person is in a rehab. So going to home from hospital or going to home from rehab, in that case, the patient will pick a home health company or or a combination of how the whole thing. What should me as a family member, as a patient, should be aware of? Sure.
So what typically is the process is that a discharge planning provider, whether it's a social worker or a nurse, at that facility at home or, at a hospital or a skilled nursing facility will give a list of providers. And then a person can do their own research as far as sorting out which home health agency they would like to have come to their home. And that can be through ratings. You can look through Medicare ratings as a help. You can also look through reviews. And in that way, a person can choose the home health agency that they want to have come to their home or for their loved one.
Got it. And when it comes to, you already mentioned that typically it's paid by Medicare, and if it's more like a workers' compensation kind of a case, then it could be a different type of insurance, right?
Correct. So it's not just Medicare, commercial insurances, workers' comp. All of these insurances typically have within them a coverage for home health. Unfortunately, it's a big tangled kind of. There are so many different types of health insurance and subsets of them. There's thousands of them when you dig deep into them, and sometimes you need to look at the fine print to see exactly what is being covered through that health insurance to ensure that home health or rehab, like short-term skilled nursing facility stays, are covered and what the coverage entails.
Very good. So moving on, it's very important to stay positive, especially during this pandemic we are facing. What suggestions will you like to give to our listeners?
Wow, that could be a very long answer show in and of itself. But there is Cleveland Clinic actually has a very, what I find, helpful program that they have, and they talks about having 6 pillars of brain health.
Okay.
And those 6 pillars are physical exercise, food and nutrition, medical health, sleep and relaxation, mental fitness, as well as social interaction. So if you take those are 6 very broad pillars to be able to drill down on, but what you're really looking for is within the scope of how you find enjoyment in life, you want to be able to personalize those 6 pillars, to really work on having a routine on a daily basis that helps you to cope.
Okay.
And so this environment has led to, that we're living in currently, has led to challenges that go beyond what we tend to face on a day-in, day-out basis. And those challenges can be different for each individual. Some people are very social and tend to go out often or have groups of friends that they socialize with. And so the environment that we're in currently has led to significant strains in that regard. Even for people who are not necessarily social butterflies that tend to be on their own and tend to reflect and read and meditate, it has been a challenge because you're not finding that same environment in order to be able to continue in those patterns. People that do yoga or that meditate in different ways have found that it's more challenging just because that isolation, even if you are kind of an individual that isolates typically, you're still going to get some aspect of socialization, some personalization, some human-to-human interaction. And most people do that in a personal manner where they're seeing somebody physically in front of them. And so the challenges of social distancing has really led to aspects of not being able to perform those functions. There's also the aspect of feeling confined, where there may be little windows of time where you're able to socialize with others, but it may not necessarily fit what you want to be able to do within the function of that particular day for yourself.
Right.
So focusing on those areas of brain health are very, very important. I would recommend to people to check the Cleveland Clinic site and look through that. But you can build upon that in different ways by drilling into each one of those pillars, which each one of those pillars could be a talk in and of itself. Yeah,
you're right. So I think we should plan having you another time where we just discuss all these pillars. Maybe that could be a good place to elaborate on all these things. But with social distancing, it's like the mental aspect of it, and mental and physical, they both are so related. We just cannot isolate one with if there is challenge in one area, it results something to address in the other area. Physical and mental, they're so closely tied.
And if I could add, I would encourage people to reach out to their healthcare providers as far as if they're looking for some guidance into how to make improvements or adjustments in those 6 pillars of brain health for resources that may be available to them.
Right. And as you just mentioned, I will now like to ask you about, you are a medical director at CareOne Health. So what really you like about CareOne? Do you want to highlight, like you mentioned, about like contacting healthcare provider, and obviously wherever we are, it's a good place to talk to with whom we are dealing, who are helping us out. So what are some of the things that you feel you're proud of, and anything that you want to share that gives a perspective for people that this is the kind of help that's available?
Sure. So first of all, I think in general, home health is a service that would benefit many people. Again, there are qualifications, just like anything else that is a benefit of health insurance. You have to qualify for that service. But home health in general really helps people in tremendous ways. The basis of it is to continue to help a person's health, and again, we're talking about both physical health as well as mental health, to improve over time when they face challenges from a health-related standpoint. And that could be, as we talked about before, leaving a hospital setting, leaving a rehab setting. It can just be from home. Primary care physicians through their offices can see if a person is showing some sign of decline, but not bad enough or worrisome enough to be hospitalized or go to rehab. And a primary care physician or any doctor through an office setting can refer to home health. For CareOne in particular, very proud of the fact that CareOne Bay Area Inc. is a 5-star Medicare-rated organization. We have an excellent clinical staff that I have tried to work very closely with. We have best practices and protocols in this environment. We have protocols in place given the social distancing and for the clinical staff to have the proper protective equipment available and used routinely. We have excellent registered nurses with different backgrounds, some with oncology backgrounds, some with intensive care unit and acute hospital backgrounds, so that they're very in tune with any particular decline or issue that a person is having, and with the communication that the clinical staff has with the outpatient treatment team. So the person's primary care physician or subspecialist, and getting that communication to those providers in a timely manner. We also have practices in place to help prevent rehospitalizations. So for people that leave hospitals, discharged from the hospital home, a very critical aspect of home health care is ensuring that person continues to improve and thrive, and if there's any setbacks, well, how can we step in and communicate with the physicians that are caring for that individual, so that adjustments can be made, so that a person can then, after they have some sort of decline, improve while they're at home and not have to, unfortunately, go back to the emergency room or be hospitalized again. And very proud of CareOne's record in being able to maintain people at home and continue to get care at home instead of needing to be back in the hospital. There are many situations where it can be very subtle changes that a person may either not recognize or kind of blame on some other factor. But when you have that healthcare provider that's being able to come to the home place, be able to use their clinical skills and intuition and be able to see that slight decline, then reaching out to the appropriate providers and making adjustments to medications, and then having that person thrive at home.
Excellent. Reducing readmissions is so critical, because not only from the cost point of view for the healthcare industry, but also we as humans, we feel comfortable inside our own homes. No one wants to be in a hospital, and if we can keep people at home. That's an excellent service.
Absolutely. It's I always try to teach people and colleagues that when you're taking care of somebody in the hospital, among the many factors that are very uncomfortable is you have different people, different shifts that are seeing you day and night. You're having blood work done at many hospitals and facilities. A phlebotomist will come in at 5 a.m. So being able to get a good night's rest, which is part of the healing process, and really the comforts of home, there's no replacing that.
Yeah, absolutely. So listeners, if you want more information about CareOne Home Health, you can go online, careonehomehealth.net, to get more information. So, moving on in the interest of time, because all these, whatever you've mentioned, these are really very valuable suggestions. But if there is any question that I should have asked, and I didn't until now, what is it? And your answer, please.
Wow. Again, a loaded. You're setting me up, AJ. I think there are so many aspects of healthcare that we really could educate people more on. It is a very complicated kind of tool to navigate, both, notwithstanding, but just understanding your insurance coverage and what that provides, and co-pays and length of stays that are covered. For example, the amount of time, number of days a year that home health services are covered, or skilled nursing and rehab facility coverage for insurances. Some have co-pays, deductibles, percentages that are covered. That is just a very complicated web to navigate. Same thing within home health. Both home health as well as healthcare in general is there are so many aspects of healthcare that so many degrees of capabilities that people may not be aware of. And again, I encourage people to reach out to their primary care physicians, their healthcare team, and I've always encouraged people to ask and query, because if you don't ask, you can never find out if a particular coverage is available or what kind of help one can get. So definitely can be topics of discussion for a later time.
Excellent. So what I'm hearing from you is always inquire, always ask of all the available options, because no matter what the situation is, there is always a path, there is always something that we can do to improve the current situation. And healthcare industry is here to serve people, to help people to get the best out of no matter what, because we all face physical and mental challenges as part of aging, growing up, and in general, at any stage of life, we can have any kind of health issue. So rather than feeling that, okay, now I'm losing it, I don't know what to do, there is always something that can make the situation better.
Absolutely.
Very good. So any final thought, any final message? Last 1 minute.
Again, educate yourself.
Okay.
I think the most powerful tool that we have is to educate ourselves, to continue to learn and engage with professionals. So from a healthcare standpoint, I always, again, will encourage people to reach out to their physician treatment team for resources, no matter how small or how big the issue is.
Excellent. So, listeners, it is really nice to hear from a physician, from a doctor saying this, because things start from the top, and the message we are getting is ask, get information. The healthcare people, the industry is here to help us out. So this is excellent information, and I'll say thanks a lot, Dr. Malek, for giving your perspective.
Thank you for having me. It's been my pleasure.
Thank you for joining us on Aging by the Bay today. This show was brought to you by Comfort Care. We hope that you enjoyed the show, and please subscribe to our podcast that is available at iTunes, Google Play, Stitcher, and SoundCloud. You can find this show and also previous shows at our website, agingbythebay.com. We love your feedback, and so please leave your comments. If you have any question for our featured guests or want to become a featured guest, please contact us by sending us an email at info@agingbythebay.com. We will be back next Saturday at 10 a.m. Until then, take care, have a great week, and be safe out there.
This has been Aging by the Bay with Ajay Sani, addressing issues on aging and services for the elderly community. Join us again next week for Aging by the Bay.